let's shift to the next topic of discussion on the show today, and that's about vaccines. A look at immunity and vaccines now. And this at a time when there's a big debate raging over immunity waning and vaccine booster shots being needed. Some countries are already giving booster shots, others are considering it. The WHO has said that the aim should be to vaccinate as many people and have asked countries not to give booster shots just now. But now a study of 614 fully vaccinated health workers in India has found that there is a significant drop in their COVID fighting antibodies within 4 months of the first shot. The findings could help the government decide on this issue of booster shots, but those heading the study have also said that waning antibodies do not necessarily mean that immunized people lose their ability to counter the disease, as the body's memory cells may still kick in to offer substantial protection. Well, let's return to the doctors to talk about this. And Dr. Sasidharan, first to you, your view, firstly on this study that has emerged about antibodies waning in 4 months.
So this is really something that we must be very careful about, because the antibodies that are studied are not the defining point of immunity. There are memory cells and other cells that kick into fighting and warding off this particular illness. So that study should not be thought about as the fact that after 6 months or 7 months my immunity is going down, because this will make people test their antibodies and then decide whether they should be going out, or take antibodies and then decide whether they should be getting a vaccine or another drug. So with respect to that, this study should not be taken as a defining point to decide about booster doses, but we do know that when the antibody levels that we are actually testing outside are actually waning down, there may be a slight drop in the immunity, but this doesn't mean you decide on the booster. But yes, it gives us a thinking that yes, we may require another booster in a short span of time, because our immunity may be coming on the lower side.
Right. Dr. Mehta, though right now in India, the focus is on vaccinating as many people. We're nowhere near vaccinating a majority of the adults yet. And there's this target that the government has of, over 60% being vaccinated by the end of the year. So that currently is the focus, isn't it?
See, Gargi, in very simplistic terms, if somebody is starving, you feed that person first, or you feed somebody who's malnourished? You obviously feed somebody who's starving. So I think we need to first vaccinate the whole population. There are not enough resources to give a booster dose to serve people. I think first let's vaccinate 2 shots to everybody, and then the high risk group we can start thinking about giving the booster shot. So I think that luxury, and that is the reason WHO has also not recommended it, because that not enough first shots have been given. So let us vaccinate the whole population, and then we come to the booster shot. I'll be the first one to take one if required.
Right, but Dr. Mehta, but it's still, this is a question we get asked very often, especially with people who received the vaccine, at the start of the year. It's been over 6 months, and all this talk of antibodies waning obviously leads to a lot of anxiety. As Dr. Sasidharan said, that a lot of people have now taken to actually testing their antibodies levels and trying to, discern the kind of protection they have from that.
See, Gargi, the problem is that because of the COVID, half of Indian population have become honorary doctors. They do their antibody test when it is not indicated. They decide whether the antibody is sufficient or not, and they should require a booster or not. I think we should leave it to the experts. At the moment, there is really not enough evidence that at what level of antibodies is sufficient or not, and what type of antibodies they are measuring. They are measuring not necessarily neutralizing antibodies or spike antibodies. I mean, so we really don't know. It is still uncharted territory. Let's leave it to the experts, and let's not go by. And as Sanjit rightly pointed it out, the immunity is 2 types of immunity: is by the B cells and it is by the T cells. It is a cellular immunity which can also play a very significant role in fighting against the second-time infection. So I think leave it to the experts at the moment. Let's not get too excited about the booster shot. Just let the whole of India who's eligible take the 2 shots of vaccine.
Right. Dr. Sasidharan, now we know this is a big issue, right? Currently in the US, they're going to make a final decision on it, especially after, Pfizer and Moderna have both talked about antibodies waning, and they claim that they at least are going to use it perhaps for the people who are more immunocompromised, and perhaps that is something that India can also look at maybe next year.
Yeah, so as Dr. Mehta said it, it's important that we realize that we are not a country and that has that kind of provision to start giving the boosters in the first place. And you rightly put it on the fact that yes, those patients who probably are at the front line, maybe the healthcare workers and probably the elderly people who are immunocompromised, may be the population who may warrant the booster, but we are not in that zone as of now. We are at the zone where we should probably vaccinate 2 shots to almost everyone in the country in order to achieve the herd immunity that we are all wanting to get, and that's about it.
Right, Dr. Mehta. Now it's also being said that in 6 months that coronavirus will become endemic and we'll be able to better manage it, and hopefully we will have that level of protection of a majority of the population. Your views on that?
Yeah, I agree with that opinion because I think, see, almost 60% of the population have got at least 1 shot, and the way we are vaccinating almost 1 crore a day, I think we should be hit a reasonable number by December end. The rest of the 20% or maybe may have already been exposed to the viral infection. So I think we will have at least 70% of herd immunity, 70% antibodies in the common population, and we would have achieved herd immunity. So COVID is here to stay. Let us be very clear about it. It is going to reduce in intensity and contagiousness, and we have to learn to live with it, with all the protective measures which we should continue to do. But it is not going to be next year as bad as what it has been in the past. Like swine flu came, it was absolutely created havoc for a very short period of time and panic. But now swine flu comes, nobody gets excited in my hospital. We isolate those patients and we take care of them. But so that's how we have to learn to live with it.
Right, Dr. Sasidharan, your view, and also what would this mean if we think of another variant of COVID emerging? You already have this new variant that's being talked about, though many are saying Delta is still stronger than the new variant. But should a new variant emerge, or is even that fear now lessened by the vaccinations and hopefully a lot of people having already had antibodies from infection?
Yeah, so all said and done, we know that the new variant that came out was markedly less virulent as compared to the earlier variant, and I think probably that's related to the fact that we've been kind of herd immunized to a certain extent, and we are getting better at it. So the virus per se is not getting a proper host in which it can probably mutate, is what I feel, to a more virulent variant, and we are achieving a level where this particular virus is going to live with us and we will take precautions during all this time. It's just like how Dr. Yatin Mehta put it very clearly, that this is going to be like swine flu. It will come, it will go, and we will take care of it. We will isolate and we will keep taking our precautions to prevent the spread of this particular disease.
All right, well, thank you so much, Dr. Mehta and Dr. Sasidharan, for joining us on the program today.